Hi, this is Dr. Khalid AlSharaf. I am a consultant surgeon and bariatric surgeon. A lot of people been asking me actually about obesity and what is obesity. Obesity being defined as the excess of your weight over the expected weight or over the desired weight. Now, how can I know the desired weight? It's very easy. There are tables for the desired weight. Depends on something called the body mass index, which is the weight in kilogram over the height in meter square. So if your body mass index between 20 and 25, that's the normal weight or the desired weight. If it goes to 26, then it is the start of what we call it overweight. 30 is called obesity type 1 or simple obesity. 35 here in Kuwait, we consider it as a morbid obesity. Now, why we say morbid obesity? Because once your body mass index reach the level of 35, then you are liable or you are more susceptible to get some diseases related to obesity like hypertension, diabetes, ischemic heart disease, respiratory problems, hyperlipidemia, joint pains, back pain, some type of cancers affecting the secondary infertility, social and psychological issues. So that's why morbid obesity have been associated with those diseases. At the same time, it have been proven by statistics that morbid obesity decrease the expected life expectancy. So life expectancy will be shortened because of morbid obesity. Now, of course, morbid obesity is considered as a chronic disease. And this means that you have to deal with obesity as if you are dealing with a chronic disease, like you are dealing with diabetes, hypertension, etc., etc. And this means that if you have obesity, there are some causes for obesity, perhaps in your genes, you cannot change them. And there are things related to the diet and the habits, the dietary habits. That's why there is certain number of patients, like 20 to 30% of people doing surgery for correcting obesity, they regain weight after 2 or 3 years. Why? Because again, obesity is a chronic disease, and if you have done any type of surgery, you have really to commit to certain lifestyle, exercise, etc., etc. And in the next video, perhaps we'll explain a little more about the surgical intervention.